inject PRP, and then before we do our PDO threads. So this is going to be a lot of stuff all in the same night. So I'm just finishing up getting all my blood ready, but what I have here is platelet-rich and platelet-poor plasma, which we have spun before you guys came on. So I am just finishing up putting all my little baby needles on. Our patient has been having numbing cream on her chest for the past hour, so she should be nice and comfortable, and it's going to be a great, great treatment. We're also going to have a guest, which is Misty, and she's going to come and help us do the rest of the Scarlet tonight. So let's talk about Scarlet while I'm finishing up getting my platelet-rich and platelet-poor plasma together. Scarlet is microneedling with radio frequency. So why would we want to do that in addition to doing PRP and doing PDO threads? Well, because we are a skin aesthetic and wellness center, aesthetic and treatment and wellness center, we want the skin to look nice as well. So we want the volume from the PRP, we want the lift from the PDO, but we want the skin to look pretty too. And that's what Scarlet's going to help to do. It's going to help lift and tighten as well as give a nice glow to the skin. So we thought we would treat everybody to that treatment as well, since I don't think we've done that for the breasts on anything yet. So, I mean, maybe it could be on YouTube. I guess don't comment if we have done it on YouTube on breasts, because then I'm wrong. But it is a great combination treatment, and if you have seen any of our events before, you know that I love combination treatments. So I'm finally done with all this stuff, and we will get started. So
one thing we do want to say is we are streaming live on YouTube and Instagram. So if it gets cut off on YouTube, head over to Instagram at RejuvenationMD Med Spa.
Excellent. Yeah. Sometimes they like to cut us off over there.
Yeah.
Okay. Let me just throw out my little garbages over here because I get very antsy when I have lots of garbage. So I'm going to put it right there. All right. So patient of ours, how are you doing? You doing good? Good. Super excited? She is. Yes. She's nodding. Yes. All right. So like I said, we have numbing cream on her chest. So I'm going to go ahead and just wipe off some of this numbing cream, right like so. And then we're going to get going with our Scarlet. And it's, so like I said, Scarlet, I don't know if I said this actually. So Scarlet is microneedling with radio frequency. So you're getting 2 treatments at the same exact time. So what the microneedling does is the microneedling makes channels, and then the needles get down to the very depth of the skin, and then it releases the radio frequency. So the microneedling itself is going to poke at those fibroblasts to make collagen, and then the radio frequency is going to irritate those same cells to make more collagen. Then as the needles come up, it leaves a channel, so your skin has got to tighten, and then as the needles come up, they're also going to, come up and out. The radio frequency essentially follows it. So you get tightening in every single layer of the skin, which makes this, it's called the Na effect. This is the only microneedling radio frequency device that has that. So that's pretty amazing, and that is why we chose to go with Scarlet and didn't go with those other types of treatments like Morpheus and Pixel and those, because Scarlet has shown us, even after 2 years of doing demos and figuring out, well, we should look at all of the options, even after our single demo of Scarlet, we all noticed results, which we were all kind of not sure about the others, and it was pretty amazing. I think if I bought any of the other machines, I think my staff would have left me, but because they were, we were just so impressed with Scarlet. So we are going to go ahead. The nice thing about Scarlet too is that there's 25 little baby needles here, and they are non-insulated. They are robotic, which means they go in very calmly. They just go like that. They don't make that noise, but they go in very smoothly. They are tapered, and the radio frequency goes between the needles. So I'm going to go ahead and get started here. I'll turn it on. That would probably be helpful. And we're going to go ahead and do... There we go. You doing okay? Mm-hmm. Spicy? Mm-hmm. Let me turn down the spice a little bit. Nope. No, give me all the spice. Alright, so this is it. I mean, it's pretty simple. So we're just going to go up to the collarbone. I don't know if I said this, but the needles are tapered, so they go in very easily, and it makes it a more comfortable procedure. I can't say I'm doing any nice settings on you because I always think that everybody wants to have the best possible results. So this is very tailored to everybody, to the specific area that we are treating. I wouldn't do certain settings on certain areas, and then other areas we can, turn it up, go up on the depth, etc. So it
Well,
can.
Why are you doing the upper pole region?
I am lifting because the whole purpose of this is to lift her breasts. So there's no reason to go around the bottom. The bottom is not going to lift. If we did up here, we're going to lift up the breast like that. Does that make sense?
Mm-hmm.
Yeah. And this is where we're going to also put the PDO threads up here to help give it a little extra lift as well. So, you pretty comfortable?
Mm-hmm.
Okay. Does it hurt a lot, or what does it feel like? Do you need to describe it at all? No, she's shaking her head.
It doesn't hurt at all.
Oh, beautiful. And we also have really good numbing cream because we have it especially made for us. And when I asked initially the compounding pharmacy to make this special cream, they're like, you want to put how much lidocaine in there? But it really does it. It's safe. It's a safe level, but it's very potent. So the Scarlet you can really use anywhere. There's skin, which is essentially all over your body. Obviously we're doing it for the breast right now, but you can do this on the booty if you wanted to lift your booty, if you wanted to do inner thighs, if you have anywhere there's laxity in the skin, we can do Scarlet. A lot of people do their face, neck and chest. You can do hands. I think you get the idea. You can do it everywhere. What else can I tell you about Scarlet?
Someone asked, how does RF affect threads?
So I would not put the threads in first and then do the RF. Although the threads don't get affected until heat gets up to 145 degrees, and this really can't go up to 145 degrees. You would get burned that way. I just don't like poking at brand new threads. So we usually will separate out. If she had had threads earlier, I would have had her wait 1 to 2 months before doing Scarlet. So, but doing Scarlet first and then doing threads, that's fine. And then she will want to come back in for another Scarlet in about a month. And she can even do it as early as 2 to 3 weeks, which is great. Because then it doesn't have to drag out your Scarlet procedures that long. There's no worries about different types of skin types. Scarlet works on all skin types. But you do, whenever you're treating body, you want to do the Scarlet at least 6 times to see the full results. And then I would tell you to do 1 Scarlet about every quarter. So it's maintenance. It's just like if you were to go to the gym and work out for 2 months or even 6 months, you don't just stop going to the gym. You still need to go to the gym for maintenance. So same thing with any of skin treatments. I would also recommend to our patient that she get a retinol body lotion, like our RMD body lotion or any of the body lotions that have some retinol in it to help the skin. People never think about retinol for their body, but it can do a really nice job, especially with pigmentation and keeping the skin healthy. I know a lot of times people ask when we're doing treatments like this or Halo, they really want me to get the crease between their breasts. And if you start using some retinol there, you can help to anti-age that area where you could get crinkles when you sleep on your side. And I know I love to sleep on my side, and I know I'm going to have big crinkles there one day, but that's why I've started my retinol body lotion early. Well, I guess not early, I'm old, but besides the point. But now you can see my face. I don't look so old because I do all of these procedures. So you doing okay?
Mm-hmm.
I'm just talking like diarrhea of the mouth right now. So we're almost done with this breast.
Someone asked, I'm 40 years old, and I have very saggy breasts. What would you advise?
Well, I always advise people to come in and let me take a peek at your breasts. If there's stretch marks and things like that, I think starting off with some Scarlet to lift and help the skin. And then that helps the PRP and it helps the PDO threads work even better. When we start with, I much rather start with skin that's healthy than skin that's unhealthy. So especially when there's stretch marks and things, it's best to start building up the strength of the skin. You doing okay?
Mhm.
Is it getting hotter as we're going along?
It's like a 1 out of 10.
Oh, perfect. Okay, I love it. So and I always say I can't predict how much lift you're going to get from any of the things that we do. So if there's a specific amount of lift that you want, then surgery is going to be the way to do things. But a lot of times, you know, that comes with complications of anesthesia, and then you have downtime, and who wants all that? But you have to have the expectation that Scarlet, PRP, PDO, those are all going to take time. It's not going to be all of a sudden you're going to get out of surgery and you're going to have bigger breasts, etc. These take, Scarlet can take 3 months after your final result to see your final results. It takes that long to make collagen. The same thing with PDO threads. We'll see an immediate lift, but in 3 months we'll see the maximum lift. And when the PDO threads are in there, we'll talk about it more when we get to the PDO threads, they don't dissolve for up to 2 whole years. So that entire time you're making collagen. So it really depends on the size of your breast, how high you want them. And again, I can't predict for you what these treatments can do for you. I just know that they work. And if you're just looking for, if you're not looking for something very specific and you just want a little bit more volume or a little bit of lift, these procedures are great procedures. For our patient here, I would also recommend for her to do light treatments to help with her pigmentation, because Scarlet's not going to get pigmentation. So we can get rid of the age, I'll say sunspots on her chest. I didn't mean to say age. I take that back. So all of these things together are just great options. I love the synergy. You can kind of think about it, again, I use the gym analogy a lot because I think people get it, but if you go to the gym and you just work out on the treadmill all the time, you're going to get so far. But if you work on the treadmill today and then you do weights tomorrow and then you swim the next day and then you go running the next day and you do aerobics the next day, all of those things are going to help your body get healthier, right? So just doing one thing all the time you're going to have, your body gets used to that in about 2 weeks. The same thing with our skin. If we just do the same thing all the time, our body gets used to it. So shake it up. Do a BBL. Do a few Scarlets. Do a few BBLs. Do some PDOs. Do some PRP. Change it up. There's never a wrong answer. All of these things are going to make you make collagen. So, you doing okay still? Yeah. We're almost done with this. I'm being pretty... I'm going multiple times because I like the multiple passes. I think it's especially important on body. So the next thing we'll do is we're going to move to the PRP. And we have some before pictures of our patients, so we'll post some before and immediately after, and then in 3 months we'll post 3-month post pictures. Let's remember that. I'm the worst person about remembering the post pictures. Okay, how you doing? You okay? Good. Okay, cool. And actually, you know what? I didn't even get here, but I didn't wipe off. I should do that middle, although I can have Misty do the middle. Let's just do the middle for a sec, because this is where I was talking about all the crinkles, but we definitely want some crinkle release. You don't have any wrinkles there, so that's nice. Yeah. We'll just do a line here, and then we'll let Misty take over when she comes in to do the other side. Are you dying now? No. Okay, good. Sometimes when it's closer to the bone, you can feel that radio frequency a little bit more. But I did forget to bring that Pronox in. We do have laughing gas, so if you are nervous about these things or anxious about these things, we do have laughing gas, and I'd be happy to have somebody go get that for you if you need it. But it sounds like you're doing great. Okay, looks like you're doing great. Okay, so step 1, Scarlet, tightening, lifting of the skin. So good texture, healthy skin procedure. Does that make sense? I hope so. Okay, anyhow, so next, we're going to do PRP now. So I have drawn her blood earlier, I've spun it down, and I have put it into some syringes. So I'm going to just wipe your skin off here. Are you okay? Yes.
A popular question we get is how much blood do you need to draw to get how much plasma from the blood?
We bleed you. Actually, I see one line that I know, I'm sorry, I keep delaying this PRP. I have one little line, I'm a little bit of a perfectionist and annoying about that, I'm sorry. So for the breast lift, we do 120 cc's, which is 120 milliliters. That's about a fourth to a third of what they use when you go give blood. So you typically don't have people get lightheaded or dizzy. I do like when people come in hydrated. I do like when people let me know that they have terrible veins, and then I schedule you with one of my partners. We actually have a really good, all of our providers draw blood really well. So one of us was always in the OR, one of us was an IV nurse, so she was on the IV team. So, and then you got me, which most of the time I can get it. We have, and then another is an ER doc, and then another's been an RN, and she was an ICU RN. So we have lots of people that can draw your blood pretty easily, let's knock on wood. But if you are somebody that's difficult to draw, you would want to hydrate really well before you come in, and then again, just make sure you're nice and relaxed and didn't go, run for 5 miles right before you got here, because then that'll make you a bit more dehydrated. All right, so like I said, we drew our blood before you guys came on, and I have 4 syringes of platelet-rich plasma, and I've got 4 syringes of platelet-poor plasma. I don't know which of these things to look at. Maybe
This is YouTube. That's Instagram.
Oh, okay, good. So sorry if I'm looking away from you. I apologize, but anyhow, okay. So, and you guys might notice that I'm using hypochlorous. This is called Puricin. This is a great thing just to have at home. It is anti-inflammatory, antibacterial. We use it as an option instead of doing alcohol. It is wonderful. Whenever people do Scarlets, I do recommend, or Halo, I do recommend you getting a bottle of that at home, because then you can just spray yourself after any of our procedures, and it really helps. It's this one, I'll show you. It's like, wait a minute. Okay, how you doing? Feeling good? Feeling strong? Okay, cool. So now we're going to do platelet-rich plasma. So this is about 5 cc's in here, and what I'm going to do is I'm going to inject it here, and I'm going to inject it here, and then we're going to inject some of the platelet-poor plasma elsewhere. Okay, so are you ready? Okay, 3, 1, 2, 3, la la la, la la la. There we go. Let me do a la la la's, a lot of la la la's. Turn your head this way. Yeah, you got it. Okay. I do think the platelets are a little spicy at times. Do you think they're spicy, or did I bicarb them good enough?
I feel it.
Okay.
Yeah,
It's
so
terrible.
a question we get often.
That was an angry, I feel it. Yeah.
Yeah. How much does it hurt? What's the sensation like?
I'd say this is a 3 out of 10.
Okay.
Not bad.
Okay. How is your pain threshold? Are you pretty high? Or pretty middle of the road? You're pretty high. Okay, cool. So maybe for a person that's not as high, maybe a 5. I don't know. I think personally, I'm going to go just a little higher in the same area. That it's not really the needle poke that's really annoying. I think it's the platelets that are really annoying. What do you think? Think it's a needle poke, or do you think it's the platelets?
The platelets.
Yeah. They are annoying.
That's not bad.
But yeah, and so people that have platelet disorders, I wouldn't use PRP. So if you have ITP or something, I wouldn't choose this as a treatment. They use a lot of PRP in orthopedics and dental work when people are doing withdrawing a lot of teeth. I've seen dentists use it for helping with remodeling of the jaw. So they've been using it in those categories of medicine for years and years. And then Dr. Runnels, I'm not sure, I don't remember how he discovered let's start using it in aesthetics, but he's a great innovator, and now we're doing it in breasts, we're also doing it in the hair, we're doing it in the vaginal area to help with, I'm going to go again up a little higher, 1, 2, 3, la la la. You're going to be a little bit more sensitive because we did the Scarlet first. So we can go over all of those slower. So,
Also, how long does treatment take too?
well, you're gonna watch it. I mean, it's generally for breasts about an hour, and most of that time is spent numbing. So I'll be done with this breast in about 5 minutes. So it really doesn't take long. It's more just waiting for you to be numb and for the blood to spin. So that's the PRP. I'm going to have you turn a little bit on the shoulders, like kind of, yeah, great, excellent. Now there's platelet poor plasma too. So we spin the platelets twice, spin the serum, we spin this, I can't speak, I'm done, I'm ready, cut. We spin the serum twice, and we usually get about 60 cc's of serum. From that, I'm going to take 40 cc's off, and I have about 20 cc's left, and that platelet poor plasma, it's all platelet poor plasma, and then the very bottom is the platelets. So I shake them up, swirl them around in 20 cc's, and so we get platelet rich plasma, like really concentrated platelets. So that's what I just injected, but we have all of this leftover serum, so we are going to use it. And we're going to go ahead and inject all over the breast. So I'm going to come in right here, okay? 1, 2, 3, la la la. Okay, dokie. You always think it's better to use what we've got than to throw it away. And you're doing great. The Dr. Reynolds uses it as well. You can do PRP with, if you have implants. You can do PDO with implants. I don't prefer to do that though, just because you just never know what's going to happen with those implants. So I think as long as they're below the muscle, I feel pretty comfortable. But above the muscle, I probably wouldn't. I wouldn't risk the PDO threads. But you doing okay?
Mm-hmm.
Okay, great.
Will someone have complications breastfeeding if they get pregnant after this treatment?
No, because I'm not interfering at all. I mean, this is your own blood, right? So this is going through your blood. This is going through your veins all the time. So I just took it out and I'm putting it under your skin. I'm not getting to the glands. I'm not doing anything like that. This is just staying in your skin. So no problems with breastfeeding or any of that. Now, we don't ever recommend basically any treatments when people are pregnant or breastfeeding, so you would need to wait to do those treatments till after you're done breastfeeding. But let's say you do it now and then you get pregnant later, there's absolutely no problem with breastfeeding and doing PRP or PDOs. Your mammograms will be fine as well. It's not going to interfere with that. I always like to tell my mammographer about how I have platelets in my breasts, and then she goes, "Oh, that's interesting. What does that mean?" And so it usually brings a conversation, but it's but you know, she can never see it. You can't see it in there. I mean, they're natural. There is not anything foreign that I'm putting into your body. I'm gonna do one more spot over here. Okay, how's your breast feel? Does it feel okay?
It's throbbing a little bit.
Is it from all the PRP? Yeah. Okay. Here, one more. La, la, la.
So Cella Class says this procedure seems to be only for small breasts with the nipples above the breast fold. What about breasts with the nipples below the breast folds?
Well, you can do this procedure on any size breasts. The risk is that you can make the breasts larger, a risk or benefit. So you can have, you can go up to 1 to 2 cup sizes more by doing PRP. So a lot of times people like that. Some people with a larger breast don't like that. So you can do it in anybody. If you just want to even do, you can even take the PRP and do microneedle it on top of the breast just to help with the texture of the skin too. You don't necessarily have to inject it, but it's not going to give you as much lift as you otherwise would get from injecting it underneath the skin. So.
And if she had bigger breasts and wanted the lift, she could omit the PRP and then.
Yeah. Oh yeah. I mean, you could just do one or the other or the third, or there's also filler. We could put filler in the breast too, but we don't really need to do that at this. I didn't. I mean, that was another thing we could have done, but I mean, I don't know how many things we could do to our patient tonight in a timely manner, right?
And what
So-
kind of filler would you place in the breast?
A Juvederm filler. I would choose one of the Juvederm fillers to put in there. I'm not going to put all of that PRP in there because you're throbbing, and we're still going to do the PDO threads. Is that okay with you? Okay. We can always put it in the bottom later too if we want to. You know, my attitude. We always want to use everything we've got. Okay, so we've done the Scarlet to help the skin. We've put the PRP and the PPP in. And she's feeling full, which you can tell. I mean, you can see the difference of the size of the breast. I mean, you can even see how much she's up here versus over on that side. So that's great. And I know it's an immediate thing, so it's not showing us what the final result is yet, but we'll see the final result eventually.
On that note, what does aftercare look like?
Basically, I like for PRP, I always recommend people wear 2 bras. Especially if you're going to be jiggling. So if you are going to be going for a walk, you're going to want to keep the girls high and tight. Just because they'll be, like you said, throbbing a little bit for a little while. And that's really it. I mean, you don't want to use any anti-inflammatories for a few days because we want the inflammation to call to your stem cells to migrate here to calm the inflammation, and that's part of the whole reason why this works. So you don't want to take anti-inflammatories like ibuprofen. Tylenol's fine. You can use ice, or you can use, I think mostly it's just keeping them close. So you're probably not going to want to lay on your belly tonight if you are a belly sleeper like me. I'm a side sleeper and a belly sleeper. I'm the worst of the sleepers. But you're not going to want to lay on your chest tonight if that's a sleeping habit that you have. But really, I mean, it's very safe. We're not doing anything that is unnatural, I guess, other than putting your platelets into your breast. So, but they are your platelets. Okay, so now we've done those 2 things. So next I'm going to do, what I've got here is a little bit of lidocaine. And so I'm going to do a little injection spot up high. She was taking a breath for that because she knows it's a little stingy. And maybe I'll go right above where I scarleted, so I'm not irritating you. 1, 2, 3, la la la. Here we go. And a little lido. A little la la la. You okay? Feels okay? Oh, good. Feels better than the platelets, huh? Okay, good. All right. So I'm just gonna rub that for a sec. Give that a minute. So that's where we're gonna come in to do the PDO threads now. So we're just moving right along.
Are you still feeling the sting of the platelets, or is that just
Barely.
okay?
Yeah. Okay, so that's not bad.
Mhm.
So what is that? About 5 minutes or so. Yeah. It is surprising the sting. It does kind of last for a few minutes, and you don't expect it. And that's why I try to tell people that we can do topical numbing, and we can do bicarbonate in the platelets, in the platelet mixture. But those platelets are stingy. But then it goes away, and then you can go, wow, look at me, I look even prettier. All right, so what I did was I did that lidocaine. Let's check to see where we were. And where did I go? Was I here? It's hard to say because it's not. Where's the epi? Where's the epi of the? Oh boy, I'm not good. I can't even see. Okay, can you feel here as a poke?
Mhm.
Okay, well that wasn't it. How about here? There are 2 choices. Okay, this is the spot. All right, everybody's very confident now, aren't we? Okay, usually I give myself a little circle with a white line. Okay, can you feel that? No? Okay. Okay, so this is just a little pilot needle. I'm going to just make a little channel for our, see, beautiful, I like when there's no blood. That is a pilot channel for our threads. Alright, so, alright, she's feeling confident and strong, right? So this is a PDO thread. It's made of polydioxanone, which is what surgeons use a lot of times in cardiovascular surgery. It's your body degrades it on its own. I don't want to say it's biodegradable, but I guess kind of. And what it does is it makes you make collagen for the next 2 years. This is a nice size one that stays in there for a while and then dissolves over time. So I'm going to go in through my little spot, and I'm going to just kind of push it. It's going to feel like a pushing. Bring the shoulder down a little if you could. Yeah, excellent. And I'm just gonna go do. And I'm gonna keep on going. You can see it's right here. I'm gonna keep going because I want to get all of the benefit. Am I killing you? Because I can reposition it. Is it okay? Okay. She says no. Excellent. That's a good word, good answer. All right, so you can see where they're 4 inches long. I'm going to see if I can irritate you a little bit more. Okay, so they're 4 inches long, which is nice length. And then I'm going to just kind of push on the thread at the top. I'm going to hold it at the bottom. And then I'm going to take the cannula out. Boom, boom, boom. That's it. That's one. Was that terrible? Was it okay?
It was okay.
Okay. Just okay.
3 out of 10.
3 out of 10 too. Okay. So as spicy as those platelets were.
Pressure.
Okay. Pressure. Okay. So I'm going to go in through my same spot. If they'll share the spot, it would be really lovely. Sometimes the pilot channel, they get mad at each other. They don't want to share their entry. We'll see if they will. Yeah. Let's see here. Okay. Okay, there we go.
Now, how many PRP treatments can people have?
As many as they want.
So could they do one, take a break, and then do another one for better results?
Oh, absolutely. Yep. I mean, it's your own blood, so I see that a lot. You know what I see that the most is for the P shot. You know, typically we'll do that for men, P shot, so we'll inject platelets into the penis for erectile dysfunction. And what happens a lot of times is they're very nervous to come in. We'll inject, and they'll typically call me in about a week or two and they'll go, when can I do that again? And they just love it. So there's no real limit. And it's, again, it's just your own body and blood. So there's no limit as to how many times you can do it. A lot of times, different procedures, it depends on what procedure we're talking about. So when we're doing the scalp, we usually recommend, I guess we don't usually, so it can be anywhere from 1 to 3 treatments. O-shot can be 1 to 3 treatments. Breast lift's typically 1, but if you have really small breasts and you really want to get the maximum, then you can do 3 treatments. So there's really not a maximum limit. Okay, I'm almost done. Just one more. I think I want to bring it, I'm going to go a little right there. Okay. Does that sound good? Sounds good to me too. Okay. So this is what I do most of the time is I talk to myself.
How long does it take to see full results?
Of all of these. So for Scarlet, hold on, let me push this a little bit further. 3 months after your last treatment, because it takes 3 months to make collagen. So I can't make that happen any faster. But with Scarlet, typically people see results after 1 because you have all of those little channels that are open that have to tighten. And people go, oh, I think I see something. Then they do their second Scarlet and they're like, oh my gosh, I do see it. And then the results just get, I'm sorry, okay? I'm going to just pull out now. And it just gets better and better. So 3 months after the 3rd treatment for Scarlet. For PRP, I always say about 4 months is our happy time. And then for PDO Threads, they are, when we put them in, you should see an immediate lift, but then also it takes 3 months to make collagen. So I got it. That's good. I got some PRP right here. After 3 months, you see. Well, you see an immediate lift, and then again, it takes 3 months to make collagen. So I'm just going to use the PRP or PPP to just kind of pull. You okay? Okay. Your breast feel like it's been through the ringer?
Not too bad.
Okay. And then we'll go over here. So again, I wish I could make collagen faster for you, but we can't. So that's why it's important always to stay on top of your skin. So again, you're not going to see results from going to the gym on the first day. Start seeing them in about 3 months. And then if you keep it up, you're going to continue to see those results. So just really think about it like that as training. And, you know, people always say, well, you know, these things are expensive. They are, but remember, people are seeing your face every day. I don't know that they're seeing your breasts every day. I guess it depends on your line of work. But, you know, these things are, your face is important. you show that every single day to people, and now we get to see it even more. But it's good to keep, people guessing. Like, why do you look so good? Oh, well, I did my hair. I started a new cream. You don't have to tell them that you're doing treatments. But when you're 60, 70, and 80, and your skin still looks great, you're going to be really happy. When you're 80 and you're starting these things, you may not be so happy. And I actually had my oldest patient come in today. I don't know if she's watching. She's 89, and she is super cute. But she's like, yeah, I vape, okay. But I also told her, she's been doing stuff for a while, and I said, you know what, when you do things that make you feel more confident, there's been studies on this, that you actually are more productive and you live longer. And who knows, maybe that's why she's 89, because she's been doing these things for a long time. Anyhow.
So we have a question about
Myalgia?
No, fibro and
Cystic disease?
endomona. I have breast
Cystic disease?
and
Fibroadenomas.
cysts. Yes, and
Fibroadenomas,
cysts.
okay. So we can do these treatments on people that have fibroadenomas. It's not going to make them grow. It's not going to make them shrink. I'm staying in the skin. I'm not going super, super deep to get down to where the glands are. So it's not going to affect fibroadenomas. It's not going to affect breast cancer. Breast cancer develops from the breast tissue. We're in the skin with all of this stuff. So PRP is not going to make you encourage any breast cancer. But so let's just take a minute and look at how good that breast looks. And maybe we should sit our patient up for a sec. Do we want to?
Yeah.
Do we want to sit
We
you
have
up?
another question too.
Okay, well, do you want me to sit her up first so that way we can see? And then I can put her back down and then I can start working on our other side. If people want to watch the other side, fabulous. If you don't, can you move that Scarlet
Yeah.
back a little? If you don't want to watch, that's okay too. But let's just see. Wow, that looks good.
How do you determine how many strings are needed or threads?
The size of your breasts. So bigger breasts need more. That looks so good. I gotta give you a mirror. The size of your breast. She's like, no, you don't. Helps to determine that how high you want them. But again, it's so hard for me to predict. But that looks awesome. And again, I just did this little part because this is going to help just kind of lift her whole breast up there. There's not reason to do here. I mean, because this is just going to be down. But I mean, you can see the difference here, and you can see the difference there. So, how does it feel now? Does it still feel throbby at all?
Barely.
Barely. Okay.
Yeah, no, it was fine.
Okay.
Someone asks, how do you handle individuals with thin, crepey skin for the threading and vampire breast lift?
I think you should start with a retinol product, get your skin healthier. But the PRP itself is going to make it healthy. I'm going to bring you back down so we can do the other side, okay? Did you want to take a picture? Did you take a picture?
Are you able to? I can't.
Do you want to take a picture with
Oh.
Yeah, take a picture with this.
Thank you.
We'll
Oh wait, your
yeah.
face.
Yeah, don't show her face.
Here, no, your face.
Oh, my face. Yeah,
Unlock
we
your
need
phone.
My face. Here we go. There we go. Gosh, that looks so good. We should show you a mirror. Well, we can show you the picture. Anyway,
Where is
I'm
your
just
camera?
thinking about what a good job I did, and I forgot your
Oh,
question.
there's your
How do you handle individuals with thin,
Crepey,
crepey
okay.
skin for the threading and vampire breast lift?
So, I think we should strengthen your skin first. So things like Scarlet, retinol body cream. It's like I said earlier. It's better to start off with healthy, hydrated skin. It's easier to work on. Excuse the analogy, but it's easier to work on a grape than a raisin. But if you're like, this is the first thing that I want to do, I mean, you can do it. We're going superficial, but we're also going deep. And platelets are very healing. So they're actually going to help your skin look even better. The Scarlet's going to help the skin glow. And if you don't like what we're doing because it's irritating you, then we give you some Pronox and everybody has a good time. That's laughing gas. Yeah. But we can usually make people pretty comfortable. So let's see, we did one breast in 40 minutes. So I think that's great. You feeling comfortable to go ahead and do the other side?
Totally. That was
Okay.
easy.
Good. So we'll do the other side. I mean, I don't know if everybody wants to watch online or not, but you can always relive this over and over again because hopefully it'll be on YouTube. Relive it. Yeah. But so we are doing a special though tonight So if you decide you want to do that Scarlet and you will get half off PDO, the PDOs, however many that you need. If you want to do the PRP, then you also get half off the threads. So typically I like to use anywhere from 3 to 5 threads per breast. If you're very voluminous, I know this was a question earlier, I have had some Ds and double Ds where I put 10 threads per breast. So it's all, you know, expectation and trying to figure out where we want them. Again, it's not an exact science, so we got to come in with the, if you want them up to here, then you probably need to go do surgery, take time off of work, have those risk factors. Here we can do this in the office, no risk factor. And maybe try this. And if you're like, oh, I'm great, then great. And if you're like, I still need more, then go get your surgery then. But just, I know so many people that have had breast implant illness. I've had, you know, you don't want to take off 12 weeks from work. And I've had a lot of people do breast implants where they've had a lot of pain afterwards. So anyhow, there's pros and cons for both. If you want a predictable result, surgery's your way. But this seems really easy, I think. It was very easy for me. But if you do want to enjoy the special that we have, and you mentioned that you've seen us on Instagram or Facebook, then you get a free retinol body lotion. Like I told you, whoever had the crepey skin, if you decide to do this, we'll start getting you prepped with that retinol body lotion. So all good things. But really, this is a great, easy procedure in the office. If you have questions, call us, find us online, share this, follow us, do all of the things that we want to do on social media so you can get the word out that breast implants aren't the only way to get a non-surgical breast lift. And hopefully you'll come see us, become part of our family at RejuvenationMD. Thanks for watching.